It was a fateful day about 2.5 months ago where I sneezed, a very aggressive sneeze, but like I've done a million times in the past. And I felt an immediate zinger down my arm and thought, oh, that doesn't feel too good, you know? But knowing that most people recover from these things quite quickly, I thought, oh, that would just be me. I'll do a few things that I know what to do for myself, and it wasn't getting any better. And I ended up going to a physiotherapist who was awesome. He was doing all the right things as far as I could tell, and he could provide me great relief if he just put me in a little bit of traction. And I was like, oh, fantastic. My arm symptoms just centralized. It was great. But as soon as he let go, I was just right back to the same old nonsense of numbness and tingling in my hands and losing muscle strength pretty quick, and fine movements in my hand were going away. And I'm like, this isn't good. So after about 6 weeks of that, I found myself on the door of a neurosurgeon, and he said, I think we're going to need to do a fusion. So he did a multi-level fusion on me, 2 levels. And I can tell you, Scott, I woke up in the hospital and I could feel my hand again. It was that quick. Like, I was so delighted by that outcome. I can't tell you how much I took for granted this thing called sensation and being able to use your hands and write and all this sort of stuff. And it made me think, like, how scary that must be for someone who doesn't really understand what's going on physiologically. And that's where I was faced with this, okay, what now? And I was so delighted when you reached out and you were very kind to send me the next level. And I uh, it was just right out of the box, easy to use, and whether you know a lot about how your neck should move or not, I gently and progressively sort of added a little bit of resistance to it. And that, I think, made me think about these patients who might be quite frightened to move their neck because they don't know if it's going to hurt them or not, or make their symptoms worse. And it was just the right touch of what I needed at that acute-ish stage to kind of start to move my neck again. And I mean, I'm back in the gym now. I'm careful, but I'm doing the weight that I was doing before my surgery. And I guarantee you the next level has helped me with that. I feel like I've got a real strong base. In full transparency, I'm not on Scott's payroll. I'm not getting paid to say this. I'm actually just someone who really does care about finding tools that are effective and can help people, whether it's myself recover from a neck injury or a surgery or neck pain that's bothering me on a day-to-day basis. And I find that the next level is super easy to use. It's self-explanatory. It provides a little bit of a very safe environment to move your neck against some resistance. And I would highly, highly recommend it to anyone who's either in sport trying to prepare for some strengthening exercises, or do some strengthening exercises for preventative reasons. But I would also highly recommend it from a rehabilitation perspective, that if you have neck pain or you injured your neck, next level would be a really, really good option for you.